Ntomba Bantu and Pamela are community healthcare workers employed in the Community Health Worker Program, which is being implemented in townships around the Nelson Mandela Bay area. Sipokazi finds it too tiring to walk to the clinic, so today Pamela and Ntomba Bantu are seeing her at her home. The 26-year-old is 7 months pregnant and about to be tested for HIV. Until now, she has been negative, and Ntomba Bantu Msutu and Pamela Nongubo want to make sure that she has maintained her status. By training community healthcare workers to counsel, test and educate patients, the program is directly linking communities to the services at the clinics. The home visit is at the heart of the Community Health Worker Program. It is an opportunity for privacy and personalized treatment without the queues and hassles of a local clinic. Ntomba Bantu counsels Sipokazi, who is nervous about the test, and reasonably so. Its result could determine the course of her and her unborn baby's life. Although she is in a committed relationship with her baby's father, he is unemployed, and things have been difficult for them. Discovering she has HIV would be a traumatic blow. After TB screening, it is time to check the test. Ntomba Bantu assures Sipokazi that HIV is not a death sentence. The test is negative, and everyone is so relieved. Next, Pamela wants to educate Sipokazi about exclusive breastfeeding. The home visit is the first time many women learn about breastfeeding. Community health workers have their work cut out for them. It's not uncommon for mothers to prefer formula because of the myths that abound about breastfeeding. For some, it is also more convenient because they have to return to work straight away. And since nurses don't always show women how to breastfeed once they have given birth, it is difficult for new mothers to overcome the lactation issues so commonly experienced at the beginning of the breastfeeding relationship. Pamela references one of her training modules, each one developed by Dr. David Woods. The modules: prevention of mother-to-child transmission, supporting mothers to exclusively breastfeed, and care of the newborn baby, equip the community health workers with medical resources and knowledge. When Pamela has explained how to latch her baby onto the breast, Sipokazi becomes excited to breastfeed, and she announces that she will do so for 2 years. This is a momentous moment, and everyone praises the mother-to-be. Today's visit has been a success. Now it's time we join up with Thandiswa Ngala and Nontembiso Mfenguza, who will be taking us to a creche. At Sinotlolo Preschool, Thandiswa and Nontembiso explain the importance of wiping down surfaces and properly cleaning eating utensils. It's essential that babies drink from a cup and not a bottle, which can harbor dangerous bacteria and cause mouth ulcers and fevers. When Thandiswa was last here, she instructed the teachers to ban dummies, which pass germs between the babies. HIV is a scourge on little lives, and the community healthcare workers support the teacher in best caring for her young pupils. Because many parents don't disclose their child's status or keep up with their immunizations, Thandiswa and Nontembiso closely monitor the road to health cards and refer children to the clinic where necessary. It's time to visit Piliswa Stout, who lives near the Motherwell Clinic. She was diagnosed with HIV in 2011 and isn't doing too well. Since she hasn't been going to the clinic, the community healthcare workers have arranged to meet her at home, where they encourage her to take her treatment regularly and practice safe sex. Nontembiso is concerned about her emotional health, and after counselling her, Piliswa agrees to take her treatment every day at 9 a.m. Being invited into people's homes, a sacred space for rest and family, founds an intimacy between the healthcare worker and the patient. It closes the gap between the clinic and the community and ensures that where there is need, a community healthcare worker can respond with counselling, education and testing. As one of the only programs in the metro concerned with improving the lives of HIV-positive children, the next home visit is a priority for community healthcare workers Nosipho Nozimba and Linda Mvebe. They take us to see Miss Matabata, a grandmother who is caring for her HIV-positive granddaughter and great-nephew. The little girl is only 19 months old. Her mother, Miss Masabata's daughter, is in hospital for TB. She was diagnosed with HIV many years ago but has defaulted from her treatment. Nosipo and Linda check the children's Road to Health cards and make sure that their immunizations are up to date. They advise Miss Masabata to treat her granddaughter's skin with calamine lotion and make sure that both children take their treatment on time each day. Miss Masabata praises Linda and Nosipo, who have helped her cope with the shock of discovering her granddaughter was HIV positive. Unfortunately, Miss Masabata is unemployed. "I rely on Zuma's child grant to support my children," she says. Like so many other grandparents in her position, Miss Masabata has a long road ahead of her. But she is not alone. Nosipo and Linda will provide all the emotional support, education and medical assistance that she needs. Deeper in the Eastern Cape, community health workers in the Lukanji area are connecting villagers to primary healthcare services. At Sada Clinic, a separate entrance and waiting area addresses the need for youth-friendly services. Now, teenagers can obtain contraception, family planning and HIV treatment without being afraid of their neighbors seeing them. As the driving force behind the services, which include reproductive health and HIV talks at local high schools, Sister Nomfundo Sigabi is on first-name terms with all her young patients. Alongside community healthcare worker coordinator Mama Notemba Makunga, she is regarded as someone to whom girls and boys can turn to in moments of crises. This is a poverty-stricken area, with hundreds of children growing up in child-headed households. Girls as young as 9 have fallen pregnant, while there are 13-year-olds running entire households on their own. These developments at Sada Clinic, then, are answering a real need for education and health services for children and adolescents. Just a few minutes' drive away is a clinic outreach, an intervention taking place for a full day once every 3 months. Mama Makunga says that scores of mothers don't take their children to the clinic as often as they should, so this is a great opportunity for community healthcare workers and nurses to catch up on growth monitoring and HIV testing. In a prefab, community health workers help the nurses plot babies' growth in their Road to Health books. If abnormalities arise, the community health workers will refer the mother to the clinic. Children stand on foot scales, while babies are placed in specially made baby scales provided by Small Projects Foundation. In a tent outside, community healthcare workers test babies and young children for HIV. Small Projects Foundation trained community healthcare workers complement the health services at clinics and health centers throughout the area. At Enoch Mgijima Community Healthcare Center, community health workers assist nurses with implementing mental health, maternal and child health, TB, HIV and AIDS services. They trace defaulters and do education in the community, which brings villagers into the reach of community healthcare. Nearby, community health workers at Hiwe Hospital form close bonds with new and expectant mothers. They encourage moms to exclusively breastfeed and do education about preventing mother-to-child transmission and healthy eating. After HIV-positive mothers give birth, community healthcare workers follow up with a clinic in her village to make sure she is on treatment and taking her baby to the clinic. Lactation consultant, counselor and medic all in one, each community health worker is providing patients with life-changing information and unrivaled access to healthcare services. As an agent of change in her community, she is a source of hope, giving the healthcare system a human face when it is needed most. As she visits people in their homes and counsels patients in the clinic, the community health worker is hope and healing personified. Day by day, step by step, it is thanks to her and to the Community Health Worker program that mothers have sworn to breastfeed, defaulters adhere to treatment, and little children might live another day or a lifetime being HIV-free.